Hi, I'm Simone Walker, one of the Deputy Secretaries at Communities and Justice.
And I'm Joanna Quilty, the CEO of the New South Wales Council of Social Service.
We know there's a huge amount of anxiety and also concern at the moment about COVID-19. We've been receiving lots of calls from service providers, but also from community members wanting to be reassured that we're looking after the vulnerable members of our community. And I just want to be really clear that for both DCJ and NCOSS, this is our highest priority.
So many of the clients that you provide services to are really vulnerable, and it's important that you can continue to support them. But while that is important, we also want to make sure that you, your staff and your volunteers stay safe and that you get the support that you need during this difficult situation. And the best way to stay safe is to be informed.
So as of next week, we'll be providing weekly updates through this channel. And I think below you, you'll probably be able to see an email address where you can contact us directly. And we'll use this time to address many of the questions that you ask, but we'll also be using frequently asked questions on both our websites. But the best thing to do at this point in time is to make sure that you're using the information from official sources, both the NCOSS and the DCJ website, as well as public health.
And because this situation is going to be changing daily, it's important that you check in to those websites on a regular basis. And also to call the National Coronavirus Health Information Line. Among other things, you'll find information on how to avoid transmission, what to do if you come into contact with a client who's been diagnosed or someone who needs to be isolated.
We thought we'd also take this opportunity now to work through some of the practical questions that have already been asked of NCOSS, so that we can give people a sense of what our answers may be and where we're going.
So Simone, we're hearing from our members and we know that services are very worried that if they have to work differently, if they have to change how they go about providing services, they in fact may not be able to meet all their contractual requirements and that they'll be penalised as a result. Does DCJ have a position on that?
What I want to be really clear about is this is not a time where we're going to be punitive, but what we want to do is keep the dialogue open between services and ourselves. If services are worried about the service provision they can provide at this time, I'd strongly encourage them to talk to their contract managers. What I'd ultimately like for the service sector is to feel really empowered about how they do their work at this point in time, and that we will be flexible about how that work happens. For example, if people need to do assessments over the phone rather than face-to-face, then we would strongly encourage people to take up those opportunities. By getting in contact with your contract manager keeps the dialogue open and also has a process of no surprises.
That's great, because we know that a lot of services are being responsive and are thinking about different and creative ways of working, and they're putting those things in place, and it would be unfortunate if DCJ were to take a very strict contractual letter of the law approach. So that's really good to hear. Another concern that is being raised with us by member organisations is the costs associated with needing to engage additional staff or use casuals or even agency staff if and when large sections of the workforce become unwell. What would be your response to that?
Certainly that's been raised in a number of fronts, and we're certainly talking to our housing and homelessness sector about similar issues. Again, I think it's about keeping that conversation going with your contract manager about what's available, but we absolutely acknowledge if you have to use contract staff or external staff, then there are costs associated with that. There's going to be some opportunities to think quite creatively about how we support people across the sector. And we think back to the bushfires and the use of the evacuation centres, where we had large amounts of DCJ staff working with Anglicare, working with Red Cross to support their services. That could be something that we could look at as well.
Services are also very concerned about increased demand. Many of them are already at capacity, particularly those in bushfire impacted areas where there is lots more demand as a result. And already they're sensing that there's going to be, not enough crisis accommodation available, not enough basic supplies, be it food or other basic elements, and increased demand for things like EPA vouchers and for emergency relief. What should organisations be doing in those situations?
So certainly on the accommodation front, that's something that we're looking at already, is freeing up housing and making sure that there is a greater availability of temporary accommodation, TA, available for people, because we think that'll be the first place that gets hit, because people may need to go into self-isolation. We're certainly seeing in the community that concern everywhere about supplies, and good relationships locally with your Woolworth, with your Coles, with your IGA is actually what we're encouraging too. Certainly there's conversations at a high level of government as well. I think we're all concerned about the possibility that large amounts of people will become unemployed, and we want to keep those conversations going with yourselves, but also with the government about support. So to stay informed, we'd really encourage you to keep tuning in. We'll also let you know when we provide updates on this channel. We hope this is helpful. We'd really encourage you to send feedback, but also things that Joanna and I can discuss, and we'll try to give you the answers in a timely way. So thanks so much.
And yes, please keep NCOSS in the loop. If you are coming across things that concern you or issues that you don't feel you have the answers for, let us know and we'll raise those with DCJ and with Simone in particular.